We would now like to invite our next speaker, the last speaker for today, Dr. Kasturi Bhattacharjee, who is a well-known oculoplastic surgeon at Shankardev Netralaya, Guwahati. And she will be talking on participation in state, national, and international forums. Dr. Kasturi, please.
Thank you very much, Dr. Sendaji and Dr. Srinivas, and to Dr. Chitra for having me in this program of corneal refractive surgery. So when we talk about a corneal refractive surgery, like my previous speakers have been mentioning, that it is basically designed to train the next generation leaders in the field of corneal refractive surgery by providing a rich academic and clinical environment with multiple research opportunities and the career mentorship. So this is all been covered by the previous speakers. And today we know that this is one of the very sought after specialty by the postgraduates in ophthalmology. So they need to choose a program which is really well formulated with good number of surgical volumes and case diversity, which Dr. Shumasrila has already mentioned. So what does one expect from a corneal refractive fellowship? We know that we want the enhanced training in the different corneal disease. We need to expose to the state-of-the-art corneal refractive surgery opportunities to treat all endosegment problems, including the cataract. Most important, educate opportunities for conducting applied and clinical research. So though I do a lot of orbitoplasty, so after my first fellowship in orbitoplasty, I had a second training in cataract and refractive under Sir Gilbert. And when I was doing the training under him, he always mentions the importance of the state, national, and international conferences. And he always mentions the state attending those conferences, whether it may be a state, it may be national, or a very big international. It really adds much more to your training program. So that is what I believe is very important. And but what we see that in the modern era, there are very several avenues to sharpen the saw, which we have seen the old generation. They read the blogs, they listen to the podcast, they watch the YouTube videos, they attend the webinars, and many of them think that why do we bother with the time and expense of a conference? So that is also a very important question which has come in many of the young generation. But what I believe it is important to attend the conference because it really adds to the knowledge bank. There's no substitute for live events and the unique career building opportunity, particularly in the local settings and the current classroom curriculum. So what I feel that these conferences really enables ophthalmologists, both fresh out and also the seasoned stalwarts, to keep up to date with the important research, to learn directly from the experiences, the trials and errors, to share the best practice, and all of them definitely have a direct impact on the daily services. I just want to mention that we have done the fellowship way back 20 years back, but I feel that attending every conference is so important so that it keeps you up to date what is happening in the present scenario. So about the state conference is very important because we really get a chance to network with the local colleagues. And the most important is that you get a platform, this boost your confidence, helps you identify you amongst the colleagues. And this really helps nowadays because in many of the state conferences we have seen there's so many wet labs, the skin transfer courses and life surgeries where every student, a resident fellow, they gets an opportunity to present the case, the posters, the videos, etc. The national forum is important because here you come to a bigger forum, you learn from an expert, you also get a chance to present your research to a larger audience, and also the one of the best examples is the All India Ophthalmological Society Conference, where you can see so many beautiful programs have been conducted. Like this time we have the Teachers of Tomorrow program, we have a special video symposium, the guest speakers, and then we have the different capsules, the cataract capsule, the cornea capsule, the refractive capsule, the OPS, the court martials, and the most important, this time they have also come with a conclave on the cruise. So there are multiple exciting programs, but every program adds to the knowledge, and it is very interesting that most of the programs you have the knowledge with the fun. So there are different ways for the residents to show the work, to get the different awards, which really boosts your confidence. And it's very nice that every day becomes a learning day for each one of us. So international is about the global advances, what is happening, what is the avant-garde technology that is happening, what is the breakthrough in the ambit of ophthalmology research, clinics. It really builds international connections at different international conferences. But what I believe that what do international conferences actually add is basically they add to the professional networking. They help me choose and to know what are changes happening in the technology in relation to healthcare. You can meet a different types of the person that you want to. You get an opportunity to showcase your work, to project yourself, and also a chance to travel, have some entertainment, and catch up with friends and colleagues. So we need to maximize the benefits of each conference. We should use the chance to network. We should choose the right conference. Most important, we should get a chance for professional visibility and get the most of it. But the question today lies in how to choose a conference. There's so many conferences going around at the same time. So you need to decide the goal of attending, whether you want to keep up with the update, whether you want to connect with your vendors or network with the colleagues or friends. Review the conference program, the endless speakers and the topics of research that we discussed. Take feedback from the colleagues who have attended it previously, weigh in your budget, and then make sure that you have enough time for it and doesn't jeopardize what is your current practice. And the best way of networking is look for people with similar professional interests. Utilize the social events in a conference to sneak a meeting with the idols. You can also, what I believe, there is no substitution for meeting someone in real person. You can also go for live tweeting the conference in a way to connect with the other attendees and also use the opportunity to meet the vendors and interact with them about the new products. And how do we have a professional visibility? The best way is to take active participation. I usually ask all my residents and fellows not to sit at the back, always to sit at the front bench, which most of us do, so that we can make an active participation. We can discuss what is happening, make your presentation very catchy, and encourage the question and answer session. So I feel that attending the state, national, and international conference really helps you in the development of your career goals growth. We know that there are a number of sessions happening in different time of the conference. It's very overwhelming, but we should not overextend. We should not try to cram too many sessions because it becomes counterproductive. We need to attend the session that matters most to you. Take thoughtful notes. These notes can help you remember the important points that which help you in the later practice. And in some case, it is also important to buy the recorded session if you hope to refer back to the session at a later date. Thank you very much for your patient hearing.
Thank you so much, Dr. Kasturi, for that wonderful presentation. Of all the conferences that you have attended, state, national, and international conferences, generally, what did you feel? Where did you benefit from most? Either way, either from gathering more knowledge or sharing, exchanging more knowledge. Which of these conferences you would guide the audience to attend more? Like national conferences are better, state conferences or international conferences? Because you have been a star in the international conferences all over the world.
I feel the AIOC is a very nice conference because simultaneously so many programs are happening. There are programs for the residents, programs for the fellows, programs for the teachers also. So I feel that every student, every resident from the first year onwards, that is what I have done. Before I became an ophthalmology resident, I started attending AIOC. So I feel that is the best for all the residents and the fellows. Once you know what is happening in your community, in your country, once you're sure that you're well trained on, then you should try for the international conference. And if you ask me which is the best, it is definitely the American Academy.
That's what I was going to ask you, because people are bombarded with so many conferences these days. If you had to attend one conference, in that given year, which would be that conference that you would want to attend? AIOS, AAO, or AFCRS, or which one?
I would like to attend AIOS.
Yeah.